From 2010 to 2019, annual death rates in England and Wales oscillated between 484,000 and 542,000. In 2020, there were 607,000 deaths, 65,000 more than the maximum in 2018. In 2021, there were 586,000, which is 44,000 more than the 2018 figure. In 2022, there were 577,000 deaths in England and Wales, and in 2023, 581,000. A huge rise when in fact a significant deficit would and should be expected. The deficit, and then some, has been filled not with the extremely old and the extremely vulnerable, but with others, many, many others, who are often young or in the prime of their lives. You might want to ascribe the excess deaths in 2022 and 2023 to the virus, but that would be a mistake. That's not what their death certificates say, and moreover, there are far too many young people dying. Far from being below the recent rolling average, excess deaths in 2022 have been above. 6% above, in fact. In 2023, when one might expect deaths to finally fall below the average, the excess has also been 6% above. These numbers are higher in the younger age groups. No one with integrity can fail to be troubled by these figures. What actually is going on? Why are the institutions whose job it is to notice these matters, to record these matters, to publicise and call attention to these matters, why are they all apparently asleep at the wheel? Why is no one listening to those raising the alarm? The research and analysis of two of Britain's most trusted doctors provides us with alarming clarity. Only this week, Sir Gary, the director of the Centre of Evidence-Based Medicine at the University of Oxford, Professor Carl Hennigan, reviewed the causes of excess deaths and concludes that they are predominantly related to cardiovascular disease. He told the Sunday Express newspaper, "This cannot be explained by COVID, population growth, or an ageing population." Consultant cardiologist Dr. Asim Malhotra, who is a world-leading expert in the causes of heart disease, also told TNT Radio yesterday that even though cardiovascular disease is multifactorial, the top of the list in the hierarchy of causes behind excess cardiac-related deaths has to be the experimental COVID mRNA vaccine until proven otherwise. This is not speculative, but based on the highest level of data, which combines plausible biological mechanism, randomized controlled trials, high-quality observational data, pharmacovigilance data, autopsy data, and clinical data. And those who choose not to acknowledge these cold, hard facts, Mr. Gary, are either unaware of the evidence, willfully blind, or lack a conscience. Alarm bells are going off all over the building, but no one wants to open the door and see if there's a fire. And we inflicted social distancing, masking, and school closures on healthy children at no risk from the virus. We did this to protect adults at the expense of our children and their social and mental health. People raised alarm, Sir Gary, but nobody listened. A society that consciously and knowingly sacrifices perfectly healthy children for adults is sick in itself. With unbearable cruelty, we isolated even those who would gladly have made the individual choice to see their grandchildren. And worst of all, we bypassed all the procedures, all the protocols, and all the science to inflict on a healthy population a brand new and untested product that had never before been used outside clinical trials, never mind approved. There was no long-term safety data, no liability under any circumstances for the manufacturers of these experimental treatments. Furthermore, there were good reasons, based on the science known at the time, why these products might be harmful. How long must we be subjected to debunked drivel being dumped in our political discourse? How long must decision makers deal with discredited modelling and moribund and captured institutions? And why will no one listen to reason when they've been proven wrong so many times? So who's actually dying now? Well, it's not the old and frail, as it was with COVID. In fact, the deaths from dementia, a key benchmark of elderly deaths, have been in deficit ever since COVID, as we would expect after a period of high mortality. Instead, particularly for cardiovascular deaths, there's been an incessant week-on-week excess mortality for months and months. in the young and middle-aged. Every age group's affected, but the 50 to 64-year-old age group has had it worse, and I'll declare an interest. They have been stricken with 12% more deaths than usual in 2022, 13% in 2023, and at least 5 out of 6 of those deaths this year have nothing to do with COVID whatsoever. For 2 years, we've turned society upside down so as not to, quote-unquote, kill Granny. Now that Mum and Dad are dying, it appears that no one cares. This is Alice in Wonderland thinking. People in their 50s and 60s, I declare an interest again, normally have many more years of active contribution, I hope so, and deeply fulfilling lives left to live, and these are the people being hit the hardest. Any culture willing to openly sacrifice children for adults is rotten, in my view, to its very core. This is the data that could sort out this issue once and for all. They admit they've got it. The MHRA admit that all this data has been released to Pfizer, AstraZeneca and Moderna, yet they claim they cannot anonymise it for public release to the public. A failure to release this data makes it look like there is definitely something to hide. A recent poll in the USA shows that more than half of the public think the vaccines are responsible for a significant number of deaths. If there was nothing to hide, they would certainly release this data for analysis, anonymised, to stop the upswell of legitimate concern. We're witnesses to the greatest medical scandal in living memory, the consequential fallout in trust, public opinion, and public confidence is only just beginning.